Coming up on Mayo Clinic Q&A.
21% of Americans have gotten at least one dose, and 11.5% are now fully immunized.
Even as the vaccination numbers continue to climb, there are still people who are riding the fence or even leery about getting the COVID vaccine.
The vast majority of people who are hesitant are not rejecting, they're unsure. They have information needs. Talking to people who are vaccine hesitant or vaccine rejecting is not a one and done conversation. It is a trust building exercise over time.
Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Steepin, sitting in for Dr. Helena Gazelka. We're recording this podcast on Monday, March 15th, 2021. COVID-19 vaccinations around the U.S. are picking up speed, and President Biden set an aspirational goal that all adults in the country be eligible to get the vaccine by May 1st. Here with us again today to discuss the latest COVID news is Dr. Greg Poland, a virologist and infectious disease expert at Mayo Clinic. Hi, Dr. Poland. Thanks so much for being here.
Hi, Dee Dee. Good to work with you again. It's been a little bit.
It has. And you know what? We're making progress, aren't we?
Boy, isn't that true? I mean, you look at it, over the weekend, over 4 million doses were given in the U.S. I looked up the numbers this morning just to be sure. 21% of Americans have gotten at least one dose, and 11.5% are now fully immunized. So I don't see any reason we wouldn't reach or hopefully even exceed that goal. The big trick now will be to get people to accept a vaccine when one is available to them. That is our way out of this pandemic.
Absolutely. Well, it is incredible progress. You know, since we last spoke on this podcast, the CDC released recommendations on activities for fully vaccinated people. Can you clarify for our listeners, what are these recommendations?
Yeah, this is really important. These were, I guess, exactly a week ago now that they released them, and they gave them an appropriate name or title. They called them interim recommendations, and they used the term guidance, not guidelines. So they're guidance and they're interim. And what they are saying is, when you weigh risk and benefit, because there is an economic and a mental health cost to being distanced from one another, they're saying that if you're fully vaccinated, you can meet with other fully vaccinated people in your home without wearing masks. You can be indoors. You can also meet with an unvaccinated, say, member of your family who is unvaccinated if they are not at severe risk of complicated disease. So the intent behind this is to allow that grandmother to get her arms around that grandkid, or in my case, to get my arms around my adult son and welcome him back. He's been in Europe as a coach. So it's really a marvelous thing to see. This is part of that rheostat, that dimmer switch, where we're starting to turn carefully, measuring what we do toward normal. And being vaccinated is what has allowed these recommendations.
Very good. Now, studies, as we know, they're looking at whether the vaccines are not only effective in preventing illness, but also effective in preventing asymptomatic transmission. So what have we learned so far?
You know, this has been one of the harder answers to get a hold of because of the nature of asymptomatic infection. But we now have data from multiple sources, from Israel, from Pfizer studies, most recently from a very large study done and published from the Mayo Clinic in Rochester, Minnesota, showing that the risk is decreased by 80+% in people who have gotten 1 to 2 doses of the vaccine. So this is really good news. That's the toughest thing to prevent, is asymptomatic. It's easier to prevent severe disease. That might seem backwards in some people's minds, but that's the case with vaccines. So this is really, really good news, and I think reinforces the concept of beginning carefully to allow vaccinated people to gather face to face and loosen some of those restrictions that we've had.
Absolutely. You know, we continue to hear from our listeners, and there's a lot of concern from those who are immunocompromised. So should people with autoimmune diseases be vaccinated for COVID-19?
Yeah. So you mentioned two things, immunocompromised and people with autoimmune diseases. Both of those categories should be vaccinated. Those are not contraindications. Those are indications to get the vaccine. Now, in those two categories, depending on how severely somebody is immunocompromised, we don't yet know how effective. Is it 80%, 70% effective? We don't know. For the autoimmune group of people, I think the concern there has been more, will it worsen or exacerbate my underlying disease? We don't have a huge amount of information on that, but the information we do have is that the demonstrated benefit far outweighs the theoretical risk. In other words, we have not seen, and when we're looking at the US, we're talking about close to 79 million people who have been immunized, and we have not seen exacerbations of underlying autoimmune disease.
And for the immunocompromised, should they be tested for antibodies to make sure that their vaccine was effective?
Yeah, that's a very good thought and idea. Right now, there is no standard recommendation to do that. I do think that might be a case-by-case basis between provider and patient, depending on their unique risks that they face or, whatever their life situation might be. That would be a consideration, but certainly not a routine recommendation.
And what about people taking immunosuppressants like prednisone?
So that's a drug that, depending on the dose that they're taking, could decrease their immune response. Now, let's just take the mRNA vaccines. We're talking about vaccines that have about 95% efficacy. I mean, that's just stunning. Plus, they're getting 2 doses, in essence, a booster dose. We may find out we have to give even additional booster doses as time goes on. We don't know that yet, but that's being tested. So depending on the dose you're on, maybe your immune response would be 91% instead of 95%. Or if you're on very heavy immunosuppressive drugs, maybe it's 50 or 60%. We don't have a way of knowing because the studies that would tell us that have just started. There's a large study of 5,000 immunocompromised people called the OCTAVE study that has just started and will give us those answers. But I think I would say that to any of our listeners that are taking those drugs, talk to your healthcare provider. Sometimes those drugs can be held, the vaccine given, and the drug restarted. Other times they can't. And sometimes the drugs that you're taking really don't have an effect on the vaccine. Other times, depending on the drug, they might. So we want to personalize that recommendation, and that's best done between patient and doctor.
Yeah, that's great advice. So we now have this goal, May 1, for all adults to be eligible for the COVID-19 vaccine, which leads to the question, when do you expect that younger children, even toddlers, might be eligible?
Yeah, really good question, because again, this is going to take all of us. I'm kind of reminded, I don't know if you ever saw in history class, World War II, they'd have men and women rolling their sleeves up and say, we're all in this together. I think that's actually a great model for the national situation we're in now. If we all roll our sleeves up and get these vaccines, we're going to emerge out of this much faster and safer. So to the question of children and even toddlers, what the drug manufacturers are doing, I think, is the right approach. They're taking it step by step. So right now it's 16 or 18, depending on the vaccine and above. The study they're doing currently is down to age 12. I think we will soon have those results in the late spring, early summer, and then they'll just keep marching that down by age bracket, being super careful of safety to know at what age can we immunize safely and get a protective immune response. I think sometime this summer and sometime the 3rd to 4th quarter of 2021, we'll have that information and we'll be immunizing most all of the country.
Very good. Finally, I know you mentioned it a little bit before, but as more people become eligible to be vaccinated, vaccine hesitancy needs to be addressed. Tell us about your recent editorial on the topic.
Yeah, I wrote that editorial with my daughter, who's a mental health professional and does a lot of research in this area, and with a woman in the Mayo Center for Innovation. And she's what's called a human-centered designer. And so between the three of us, we collaborated to look at how do we think about vaccine hesitancy, and how do we, as healthcare providers, deal with it in the best way possible. And it starts with recognizing that the vast majority of people who are hesitant are not rejecting, they're unsure. They have information needs, they have empathy needs in some cases. And so in that editorial published in Vaccine, we actually provide what we call an empathy tool for healthcare providers to use, a starting point for them to have discussions. And I think that's one of the issues that we would propose, is that talking to people who are vaccine hesitant or vaccine rejecting is not a one and done conversation. It is a trust building exercise over time, helping people to allay their fears while recognizing the valid fear of the actual disease. So, we're at a point, as I mentioned earlier, where tens of millions of doses of these vaccines have now been given. When we look worldwide, it's hundreds of millions of doses have been given. And we have not been able to define any safety concern other than the risk of anaphylaxis, which we discovered very quickly in this. So I think that should help allay a lot of concerns. And then it's talking individually with patients. I have found that to be a very, very useful strategy. It goes back to our roots, right? At the Mayo Clinic, we have a simple motto that we talk about all the time: the needs of the patient come first. And what this editorial is really doing is flipping things around to say, okay, if the needs of the patient are informational, let's start there.
Very good. Dr. Poland, anything else that you wanted to add before we let you go today?
I'm just, we've been through a lot of sad and negative information. We're emerging from that. It's delightful to talk about progress. I think one of the things we've seen is a quite a dip in the number of deaths, hospitalizations, and even cases. They're still in the 50 to 60,000 cases a day. So we can't relax. This is one of those hiatus moments where if we all choose to do the right thing with the recommendations that have been made based on science, we're going to get out of this quickly. If we make the decision not to do that, we will do what we've done so far and prolong it.
Yeah, very, very well said, Dr. Poland. Well, our thanks to Mayo Clinic infectious disease and virology expert, Dr. Greg Poland. Thanks again for chatting with us today.
Good to be with you.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.